Did you know that millions of people around the world take certain medications every single day, trusting that they're helping their bodies heal or stay balanced? But many of these drugs may actually be doing more harm than good. Especially for seniors, some of the most commonly prescribed medications can lead to serious long-term side effects, issues that are often mistaken as part of normal aging. But growing evidence from multiple studies shows a different picture. In many cases, these drugs may no longer be necessary, may have safer alternatives, or may need to be closely monitored to prevent dangerous outcomes. In this video, we'll walk you through 4 medications that seniors should be cautious about or avoid, and most importantly, we'll also explore safer and more natural alternatives that may support your health even better in the long run. Now let's be clear, this video is not suggesting that you stop taking any medication on your own. Always speak with your healthcare provider first. Our goal is to equip you with the right information, help you ask smarter questions, and possibly open your eyes to better options that could significantly improve your quality of life. But before we dive in, please hit that like button and subscribe to the channel so that this important information reaches more people who truly need it. Without further delay, let's get started. 1. Proton pump inhibitors. Let's talk about proton pump inhibitors or PPIs, like omeprazole, pantoprazole, and lansoprazole. Some of the most prescribed drugs for heartburn, acid reflux, and ulcers. They work by reducing stomach acid and can bring fast relief, but long-term use, especially in seniors, comes with serious hidden risks. Studies show that PPIs can block your body from absorbing key nutrients like vitamin B12, magnesium, and calcium, all of which are already low in many older adults. A 2022 study found a 65% higher risk of B12 deficiency in people using PPIs for over 2 years. Low B12 can lead to fatigue, memory loss, nerve damage, and even dementia. PPIs also lower magnesium levels, raising the risk of muscle cramps, irregular heartbeat, anxiety, and seizures. And by reducing stomach acid, they can impair calcium absorption, increasing the risk of fractures and osteoporosis. That doesn't mean stop your meds cold abruptly. Always talk to your doctor first, but if you've been on PPIs long-term, it may be time to explore safer, natural ways to manage reflux. Start with diet. Cut back on spicy, fatty, and acidic foods, caffeine, and alcohol. Eat smaller meals more often and avoid eating right before bed. Elevate your head while sleeping to prevent nighttime reflux. Natural remedies can also help. Chamomile tea and aloe vera juice soothe the digestive tract. Probiotics support gut health. Turmeric fights inflammation, and for occasional relief, a little baking soda in water can help. Just don't overdo it. Your gut can heal. You just need the right tools. 2. Statins, cholesterol-lowering drugs. Statins, like atorvastatin and simvastatin, are some of the most commonly prescribed drugs for seniors used to lower LDL or the so-called bad cholesterol and reduce heart disease risk. For those who've had a heart attack or stroke, they can be life-saving. But here's the catch. Many older adults are put on statins just because their cholesterol is high, even if they've never had heart disease. Recent research shows that for people over 75 without existing heart issues, statins often don't improve lifespan or outcomes, yet millions still take them daily, without knowing the possible side effects. Muscle pain and weakness are the most common complaints, and in seniors that's dangerous. Weakened muscles can lead to falls, fractures, and a faster decline in independence. Even mild muscle damage from statins can start a dangerous cycle of frailty. For older men, there's another concern. Statins may lower testosterone. Since testosterone helps preserve muscle mass and strength, low levels can lead to sarcopenia. And maintaining muscle mass isn't just about looking fit. In seniors, it's directly tied to survival. Muscle mass supports balance, joint stability, blood sugar control, and metabolic health. When muscle breaks down too rapidly, especially if testosterone is suppressed, the risks of falls, fractures, hospitalizations, and even early death go up significantly. Statins may also raise blood sugar levels and increase the risk of type 2 diabetes. Some users report memory loss or brain fog, which even the FDA has warned about. This doesn't mean statins are bad across the board. If you've had a heart attack or have a genetic condition like familial hypercholesterolemia, they may be essential. But if you're healthy and over 75, it's worth asking, do I really need this drug? Many people can lower their cholesterol naturally with simple changes, eating more fiber, cutting trans fats, staying active, reducing stress, and including healthy fats like olive oil, fish, and avocado. In fact, studies have shown that walking just 30 minutes a day can lower the risk of heart disease almost as much as statin drugs in some populations. Supplements like omega-3s, magnesium, CoQ10, or even red yeast rice might help too, but always under medical guidance. Ultimately, the key is not to fear statins, but to better understand when they are truly necessary and when other options might serve you just as well, if not better. Don't hesitate to speak with your healthcare provider about your individual risk and whether continuing statin therapy is actually the best path forward for your age and overall health. 3. Benzodiazepines. Now let's talk about a class of medications that's often prescribed to help with anxiety, insomnia, or even muscle spasms, and that's benzodiazepines. You might recognize names like diazepam, Valium, lorazepam, Ativan, alprazolam, Xanax, or clonazepam, Klonopin. These drugs work by calming the brain and central nervous system, and in the short term, they can feel incredibly effective. For someone dealing with chronic anxiety or sleepless nights, they can seem like a miracle. But when it comes to long-term use in seniors, benzodiazepines may quietly cause more harm than good, and in some cases become downright dangerous. The concern here isn't just about addiction, though that's part of it. Benzodiazepines are known to be habit-forming, and over time, the body builds tolerance, meaning you need higher doses to get the same effect. But what's especially worrying in older adults is how these drugs affect the brain and body in ways that mimic or accelerate age-related decline. Studies have consistently shown that benzodiazepines increase the risk of falls, fractures, cognitive impairment, and even dementia in the elderly. Another issue is that benzodiazepines can disrupt natural sleep architecture. They may help you fall asleep faster, but they suppress REM sleep, the deepest and most restorative part of the sleep cycle. So while you might be asleep, your brain and body aren't truly recovering. Over time, this poor quality sleep can worsen fatigue, mood swings, and memory issues, creating a vicious cycle where you feel worse and reach for even more medication. Despite all of this, benzodiazepines are still widely prescribed to seniors, often without clear exit plans. What starts as a temporary solution for stress, grief, or insomnia sometimes turns into years of daily use. So what are the safer alternatives? For anxiety, therapies like cognitive behavioral therapy, CBT, have been proven to be as effective and more sustainable than long-term medication use. Mindfulness techniques, gentle exercise like Tai Chi or walking, and even simple daily routines can help regulate the nervous system naturally. Supplements like magnesium glycinate, L-theanine, or ashwagandha have shown promise in managing anxiety and improving sleep. For sleep issues, natural options like tart cherry juice, which contains melatonin, chamomile tea, or valerian root can offer support without the cognitive side effects. And perhaps most importantly, focusing on sleep hygiene, like keeping a consistent bedtime, avoiding screens at night, and limiting late-day caffeine, can go a long way in restoring restful sleep. 4. Anticholinergic drugs. Last but definitely not least, we need to talk about a hidden class of medications that many seniors take without realizing the long-term consequences, and that's anticholinergic drugs. You might not recognize them by name, but they're everywhere, in over-the-counter sleep aids, allergy medications, and prescriptions for bladder control, depression, and even certain types of pain. Medications like diphenhydramine, commonly found in Benadryl and sleep aids like Nitol, oxybutynin for overactive bladder, amitriptyline for depression or nerve pain, and chlorpheniramine for allergies, all fall under this category. What these drugs have in common is that they block acetylcholine, a key neurotransmitter involved in memory, learning, muscle function, and the nervous system. Now here's the scary part. Multiple studies have shown that long-term use of anticholinergic drugs can significantly increase the risk of cognitive decline and dementia, especially in seniors. A major study published in JAMA Internal Medicine in 2015 found that older adults who took strong anticholinergic medications for long periods had a markedly higher risk of developing dementia, even several years after stopping the drugs. This is because acetylcholine plays a crucial role in brain communication. When that signal is repeatedly blocked, over time, it can impair memory, learning, and overall mental clarity. And since memory lapses and confusion are already common concerns with aging, these drugs often go unnoticed as the true cause, quietly worsening mental decline while masking the symptoms they were supposed to treat. But it's not just the brain that suffers. Anticholinergic drugs can also cause blurred vision, constipation, dry mouth, urinary retention, drowsiness, and dizziness, which further increases the risk of falls, dehydration, and digestive issues. In some cases, people may be prescribed additional medications just to manage the side effects of these drugs, creating a cascade of unnecessary treatments. And what's most troubling is that many of these drugs are available over the counter. A senior looking for something to help them sleep might grab a pain reliever or an allergy pill without realizing it contains a strong anticholinergic that could impair their brain health if used regularly. The problem is silent and slow, and by the time symptoms appear, the damage may already be done. At the end of the day, the biggest danger with anticholinergic drugs is that most people don't even know they're taking them. They're hidden in plain sight, in common household medications that are taken casually for sleep, allergies, or pain. If you're a senior, or caring for one, take a moment to check your medication cabinet. Look for ingredients like diphenhydramine, doxylamine, amitriptyline, or oxybutynin, and talk to your healthcare provider about safer options. The sooner you start reducing your exposure, the better your chances of preserving your cognitive health as you age. Before we wrap up, remember, this video is meant to inform, not to diagnose or treat. Never start or stop any medication or supplement without first consulting your healthcare provider. Your health decisions should always be made with the guidance of a qualified professional who understands your personal medical history. If you found this video helpful, please like, share, and subscribe so more people can gain access to this important information. Thanks for watching, and we'll see you in the next one.